We've got football, we've got Tiger, we've got the Ryder Cup, the happiest person on the planet. We've got all of these distractions going on. Urban Meyer. We've got football, we've got Tiger, we've got the Ryder Cup, the happiest person on the planet. We've got all of these distractions going on. Urban Meyer. You can go to the website maximizeyourmedicare.com. There's a free weekly newsletter. You should sign up to it. There are tips for both beginners and experts alike. As always, today is not financial advice. I'm qualified and licensed to give financial advice, but not here in public. I would need to know a lot more about you. I don't frequently comment about the news on the podcast. I generally try to keep it limited to overall principles and other things from the book that people are not fully aware of. But today I need to veer off that because a headline crossed today, which is very important, and it basically proves the issue that I make in Maximize Your Medicare, which is that when you are dealing with Medicare Advantage, you need to know a few different things. The first and most important is this is annual contract. That means it runs from January to January. You cannot get around this fact. That also implies the following, which is that all of the facts, all of the cost-sharing responsibilities you have, meaning the health deductible, the drug deductible, the co-pays, the co-insurance, all of that, every single detail, every single one of them is subject to change on an annual basis. The second important fact to know and that you must consider is the idea that all Medicare Advantage plans have a network. Now, depending on the type of plan, and then you get the alphabet soups, HMO, POS, PPO, for example. These definitions all involve a network of some sort, and you cannot generalize. You cannot just presume because it says HMO that they all work and act exactly the same. That is not the case. The simple reason here is that the Medicare Advantage carriers are competing with each other fiercely. Every single detail, every last one is being competed upon in a very aggressive manner. And the financial implications to you, in other words, the total cost of health care to you, depending on your medical situation, depending on your prescription list, all of that stuff is in flux. And because of what I said earlier, annual contract, it's in flux and can change from year to year. We're not getting away from that. There is no way, no chance that we're going back to a world where you're just going to be able to stick with one particular Medicare Advantage plan, put it into your bottom drawer, and then next year that plan is presumed to be the best for you. I know that runs against human nature. People don't like to change. That I get. That is commonly accepted. And it doesn't have to do anything with insurance matters at all. This could be with which drawer is my sock drawer. None of that stuff matters. So today, a headline crosses my eyes, and it proves this exact point. The exact point that's made in Maximize Your Medicare in every single edition. It's 6 editions now, which proves the point that I make about Medicare Advantage. When you're talking about annual contract and you're talking about network, these are things you must understand. And today, the headline passes that a large medical provider, healthcare provider, called Envision is having a disagreement with the nation's largest health insurance carrier, UnitedHealthcare. Full disclosure here is that my firm GH2 Benefits, gh2benefits.com, which has permissions, it has affiliations with UnitedHealthcare in multiple locations. Nevertheless, the headline that passes on Axios.com, AXIOS.com, clearly states that UnitedHealthcare is sending out notices or has foretold that, hey, this healthcare provider, Envision, may not be a network provider next year. And now you see exactly the point, which is that all Medicare Advantage plans do have this issue that you must pay attention to. Right? There's a reason that I said you don't get to put your Medicare Advantage plan in your drawer with your socks and then just roll it every year without paying attention to it. Because you can see what ends up happening. If you have a particular type of Medicare Advantage plan and you rely on a particular healthcare provider, and it doesn't have to be Envision, it could be anyone, it could be Dr. Jones on the corner who you've seen for 30 years. The fact of the matter is that they come to agreement with the Medicare Advantage carrier, whoever that is. It happens to be UnitedHealthcare in this situation. It could easily be Jim Bob's Medicare Advantage plan in state X. The actual specific names don't actually matter. What does matter is the fact that this type of payment agreement needs to be reached on an ongoing basis. And if they don't agree for some reason, then who you thought was in network this year may not be inside your network next year. Unfortunately, this can even happen mid-year. That one I cannot control, right? Meaning that, yes, has this happened in the middle of a year where a hospital system has disagreed with a Medicare Advantage carrier, and then they go from in-network to out-of-network at a blink of an eye? Yes, that can occur. Has it occurred? The answer is yes. I can remember a couple of very large cases. In Pittsburgh, for example, I commented on a radio show on the CBS radio network where very large hospital system, university-based hospital system, came to a disagreement with the very large Medicare Advantage carrier in that particular location, which was eventually resolved. But you can imagine in a city that is large and does rely, however, on a large medical system, you could understand that it would be highly stressful for those persons who believed that they had in-network coverage from their Medicare Advantage plan just to find out that all of a sudden that hospital system was out of network. There is no easy way around this. It is inherent. It is an inherent characteristic of Medicare Advantage plans. There is this concept of network. The network can change even mid-year. And in the absence of a very, very special set of circumstances, one which would require the intervention of the CMS, the federal government that governs Medicare, there is no real practical way to switch among Medicare Advantage plans during the middle of the year, let's call it July. Beginning in 2019, there is going to be an extra switching period, an extra open enrollment period running from January 1st through March 31st, which will allow you to change among Medicare Advantage plans, you'll be able to make the change once. The natural question to ask here is, what can I do to avoid this in the future? And that's going to be pretty difficult, but here are a couple of possibilities. The first is this is the instance where you may want to choose PPO instead of HMO. Now, I know there are lots of variations among HMOs, so you're going to have to use what I'm about to say as guidelines, not as hard and cold facts for your location. That said, PPOs will allow for coverage, meaning that you can be covered at out-of-network providers, albeit at a higher cost. So now in this particular instance, if Envision was an in-network provider and now becomes an out-of-network provider, it is possible that HMO policyholders would be entirely responsible for the costs. It's possible. I didn't say 100% because, like I said, HMOs do vary substantially even within the definition of HMO. That said, PPOs will cover you in this instance, albeit at a higher cost. So one way of thinking about it is that if you are going to be enrolling in a Medicare Advantage plan because that is your preferred path or your configuration, then you may want to choose PPO as opposed to HMO, all else equal. Now, of course, the fact that I'm using the terminology all else equal is quite a caveat, right? Because by its nature, all else is not equal. We know this. So that's one potential path, meaning that if all else were equal for you in the future and there were a PPO that fit your budget and your other healthcare requirements, that one way of avoiding this in part is to choose a PPO instead of a narrow, tight HMO, which makes you responsible for costs at out-of-network providers. The other one is that the other possible path here is you can try to switch to Medigap at the beginning of the year. Now, this is going to be important because coming into 2019, as well as approaching the annual election period, there are a couple of potential paths. First of all, remember that if you are not guaranteed issue person, meaning that if your acceptance into Medigap is not guaranteed and protected by your consumer rights as detailed by the CMS, the federal government, then the Medigap carriers do have the right to ask you medical questions, and they have the right to deny your application. That said, if you pass underwriting, it is possible to switch from your Medicare Advantage plan to Medigap and a standalone prescription plan. Now, the reason that this podcast is coming out now is because you're going to be able to prepare for this, but not too far in advance, meaning that you have to set the effective date for January 1st, and there are limits to how far in advance you can apply for Medigap. And that will vary by the carrier. If this were the path that you were going to choose, I urge a great deal of caution. And the reason is you cannot simply choose your prescription plan first, because since your Medigap application is not assured to be accepted, I don't want listeners to have this situation where they've chosen a prescription drug plan, which has ejected their Medicare Advantage plan, because you cannot have both. And then after the fact get rejected by Medigap, which would leave you with Medicare Part A, Part B, and a Part D without extra coverage if you required inpatient hospitalization or other healthcare services. It is very important to time this correctly. I urge persons in this instance to find the assistance of an expert. The third path that you may want to choose is to choose a HMO which has wider flexibility with respect to network. Now, as I said in the past, a point I've been making whenever I speak in public as well as on this podcast, I've been saying that HMOs have flexed their definition. It is not necessarily the case that out-of-network providers are uncovered. So let me repeat that. Not all HMOs make you fully responsible for out-of-network provider healthcare. You're going to want to choose carefully. That period is going to be approaching quickly. We're going to know the details of 2019 plans in just under a week now. That information is going to fly at us fast. It's going to be fast and furious. However, there is no question that the intense competition amongst Medicare Advantage carriers has resulted in a loosening of the definition of HMOs, certain managed care plans, where people are going to be able to use out-of-network providers. So you'll have to tread carefully, but it is possible. Before we go down the wormhole too much further, I'm going to stop there. Be sure to subscribe to the Maximize Your Medicare newsletter. You can find it on the website for the book, www.maximizeyourmedicare.com. Till next time.